Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is the psychiatric patient's assessment. Now whenever you're working even as a clinician, you come across a lot of psychiatric patients and you should know how to assess these patients in details. There are a lot of points that basically differ from a normal patient, from a normal medical or surgical intervention patients, and when we are treating patients with psychiatric problems. This is because of their thought content and obviously because of their thought form that is quite deviated in a lot of cases. So in the first section, basically, we'll be dealing with the history taking. How do you take the history from a psychiatric patient? That is very important. The basic principles of history taking, they usually differ from normal history taking, which is usually taken in the medical or surgical wards. And so the establishment of the timeline is sometimes very important whenever you're dealing with a psychiatric patient. Understanding the patient and empathizing with the patient is very important. Sometimes the doctors won't empathize with the patient and they won't understand the problem in detail that the person or the patient is suffering or going through. In the second section, we'll be dealing with the mental state examination, which is also known as MSE. And the appearance and behaviors over here are very important. First of all, the speech is noted down, and then we'll move to the affective disorders or the mood disorders, and then the thought form and the thought content is also commented upon. Obviously, we'll move on to the delusional phenomena that the person is suffering from. It's basically the firm thoughts or the firm content, thought content that is basically just delusional and it's just a fantasy that is basically thought from by the patient himself or herself. Finally, the hallucinations will be discussed over here in this section, and the different type of hallucinations that the person can suffer from, and how can we predict that the person is suffering from hallucinations, and to basically develop that relationship with the patient in which he or she will tell you about his hallucinations and his delusions as well. In the third section, we'll be dealing with the cognitive and the physical assessment. So the cognitive assessment is done at one place and then we follow it up with the physical assessment of that patient. The physical assessment is done after the investigations and it can involve the lab routine investigations obviously, and then we'll be dealing with the urine testing, the electrophysiology and the imaging techniques that we can go through. It can include the radiographs, the CT scans and the MRIs, etc. In the fourth section, we'll be dealing with the diagnostic summarization. So it's very important to safeguard yourself as a doctor, and safeguarding of the patient as well is important at this level. First of all, the signs of abuse are looked for. If we find any signs of abuse in cases of children or women, we have to report them. And then the engagement with the patient and the engagement with the other helpful criteria is again very important after the diagnosis has been made. Then in the fifth section, we'll be dealing with the response to the patient's histories. What are the different responses that we get after we have taken the history from the patient? The effective response to the patient's history is again very important. It's a part of basically managing the patient and managing his problem. Then the other aspects, transference and co-transference, are some of the problems that the psychiatrists go through, and they should know how to deal with these phases. Then in the last, we'll be discussing the defense mechanism of the patient. How does he defend himself when he goes through these transference and countertransference cases? So this will be the crux of this lecture. I hope you want to learn more about the psychiatric patient assessment. So do watch the other sections to this lecture as well.